year ago this week, many of us realized that COVID-19 was going to dramatically change our lives. We spoke with several Americans from across the country to reflect on the last year and look ahead. We began by asking if the group trusted the vaccine.
I trust the vaccine, but I don't think that the vaccine is just going to be the cure-all and everything is going to be lovely. But I think this makes things a whole lot better.
The vaccines that are out seem to be pretty effective. It seems to be a much better way to achieve herd immunity via immunization than, just having the virus ravage through communities.
I'd rather wait. I don't want to be a guinea pig.
Mm-hmm. And is that how you view taking the vaccine right now for the 50 million Americans who've taken it?
Yes, ma'am. At this point, I would rather wait a year or two, make sure people aren't dying from it or turn into robots or something like that. But I'd rather wait.
And Gabriel, is that where you are?
I would never consider taking it. Like Sandy said, I don't want to be a guinea pig.
Sherry and Gabriel, you live in states where there is no mask mandate. Do you both wear masks? Sherry?
Yes, I do. I'd rather err on the side of caution and not transmit anything to somebody else that could cause them to get sick and possibly die.
I just don't think they work like they say they do.
Do you consider it a burden?
Yes, ma'am, I do.
Why?
Because they're trying to force me to do something that I personally don't feel I need to do.
When you hear this is aerosol, that it passes through the air, that coughing is in part how this virus is spread, do you not believe any of that science?
No, ma'am, I don't.
The other day I was walking at a restaurant and they had onion rings. I had my mask on. I could still smell it. So if I can still smell those onion rings, what else is getting through that mask?
Well, in terms of the aerosol particles that you would be sharing, do you not see the barrier as doing anything?
No, it's not. Obviously, I can still smell those onion rings cooking. So what else is coming through that mask? So the mask isn't working.
How many of you would feel confident to go in and sit indoors and eat at a restaurant right now? Can I see a show of hands?
We've done it times. We've already done it several times. We do it at least once or twice a month.
And would all of you feel safe getting on an airplane right now? Show of hands.
My wife came back from a funeral. She flew all the way to Oregon, and I just didn't have any problem. So
I am going to take my first flight since the pandemic in a couple months. My sister and I both got our vaccines and everything, and we're going to put our masks on, and we're going to go to Vegas and have a good time. That's what we're going to do.
But you got your shot and you got your mask, so you've got your armor with you, Tanya.
Yes.
Has the past year been difficult for you, Sandy?
It hasn't really changed too much.
Sherry, has this been tough for you?
It has been. As a teacher, there's some distancing that's difficult with 5-year-olds. Sometimes when a child is crying or they're upset, I kind of do throw that social distancing out, and I have to give them a hug and try to calm them down. But as far as difficulty, it's been hard to be in the minority in my community as far as following the regulations and the suggestions for safety.
What part of it has been difficult?
It's been difficult to be the outsider of when others are skeptical of the validity of the pandemic.
Tanya, did you feel that you had a similar experience? I mean, what part of this past year was difficult?
When the pandemic hit, my family got to see it up close and personal. My nephew, early on, was stricken with the pandemic. We thought we were going to lose him. He spent like 3 weeks on a ventilator. Couldn't get in to see him. It was heartbreaking.
Juan, what about you? How was this past year for you?
Personally, actually, it hasn't affected me as much as it's affected business owners. It's affected educators like Cherie. I feel like I'm lucky in that sense, obviously, but as a gig worker, I do take some risk. I wear my mask. I ensure that my passengers wear masks as well.
When this is over, what is it that you are looking forward to doing?
My parents are elderly, and I do wear a mask with them. But I'm looking forward to going up to them and being able to hug them and not having to wear a stupid mask.
Is that what everyone misses the most, being able to hug and kiss and shake hands?
Sure.
Absolutely. I mean, for me, church is important to our family. We haven't been in church in over a year. We've been doing some Zoom things and everything.
Same here. Our church was big huggers during our giving of the peace, and I just miss them.
And Tanya, you were saying yes.
Yes, I come from a big family, and my mom is still with us. She's 91 years old, and she's in better shape than all of us. Just being able to, have her come to dinner. I can't do that now.
Sherry, what about you?
I'm definitely missing hugging my friends and spending time with them. We didn't do it as much as we used to. We were always like, oh, we'll see each other sometime. Now we're definitely going to hang out.
Juan, what's the first thing you're going to do once you get that vaccine?
Probably travel, just be around friends and, go to restaurants, to have things be back to normal. Just, go out in the street and see people walking around without masks.
When you hear, Juan and Tanya and Sherry talk about their experiences and their hope, do you have a second thought and say, well, why not take some of these measures, like getting a vaccine or wearing a mask, if it gets us back to normal faster?
No, ma'am.
None of it makes you question your decision?
No, ma'am.
And same with you, Sandy?
As far as wearing a mask, I think that's all over. And I think this virus is pretty much done. It's just we're on the long stretch or the last stretch, and that's pretty much it. But you can see the checkered flag; it's already there, so it's pretty much done.
But as you heard Dr. Fauci warn this week, the country still has between 60 and 70,000 new infections a day, and we are at risk of another spike. The virus is not yet done with us. An extended version of our conversation is available on our website. We'll be right back.